pain, numbness, and weakness in your hands, all symptoms of carpal tunnel syndrome. Research at Mayo Clinic suggests there are many causes of carpal tunnel syndrome, and thankfully there are treatments that can help. But how do you know which treatment is right for you? Let's go to Mayo Clinic to learn about some options.
Screwdrivers, constantly ratcheting.
Christian Mendez depends on his hands to make a living.
Everything I do, it's using my hands. Without my hands, I can't do my job, period.
So when Christian developed symptoms of carpal tunnel syndrome, he got worried.
It causes sensory conduction changes in the nerve, so people perceive that their hand is numb. Sometimes they can perceive it as pain.
Dr. Peter Murray says it may also cause weakness.
If I'm holding a wrench or something, it would just slip out of my hand.
Carpal tunnel syndrome happens when the main nerve that goes to the hand gets irritated by a tight band of tissue called the transverse carpal ligament. The treatment you choose will likely depend on how severe your symptoms are. If you've had the condition for less than 12 months, splinting, injections, and time may help resolve the problem. If symptoms have lasted longer than 12 months, surgery may be necessary. During carpal tunnel release surgery, doctors make a small incision through which they cut the tight carpal ligament. This releases pressure off the nerve.
Should be good.
Some studies show up to 99% of people who have carpal tunnel surgery gain relief from symptoms. But Dr. Murray has shown in a recent study that results of surgery may not be as good if you're over 75 or have had carpal tunnel for a long time. Older people may also have other conditions, such as diabetes or arthritis, that cause overlapping symptoms. But Christian, who's only 58 years old, says surgery has allowed him to return to work in full force.
I'm back in action now.
It took Christian about 6 weeks to recover from the operation, but he says it was worth it to be able to work pain-free. For more information about the causes, symptoms, and treatments of carpal tunnel syndrome, visit mayoclinic.com. For Medical Edge, I'm Vivian Williams.